Lawmakers are considering legislation that could affect the state's gun laws. Republican Governor John Kasich recently called for changes in response to mass shootings happening across the country.
Dr. Mike Gittelman is a pediatric emergency room physician, and he's here with us this morning to offer some perspective. And you're part of a statewide group, which is?
The Ohio chapter of the American Academy of Pediatrics.
What's your experience as an ER doctor with gunshots?
Look, we all hear about these stories such as Parkland and Sandy Hook, but those are really only the tip of the iceberg. In fact, firearms claim about 30,000 lives every year in America. They cause about 75,000 ER visits. In Ohio alone, there's been about 1,100 deaths annually and about 2,000 ER visits. And what's interesting is the majority of these deaths are from suicides, and the majority of these ER visits are from violence and assault, but about a third of them are because of unintentional injuries. And in fact, firearms are the second leading cause of death in pediatrics, or trauma death in pediatrics. And so we're just next to motor vehicle collisions.
The second leading cause of death in children.
Yes.
Yeah. Now, with that in mind, what are your thoughts about what has been discussed as possible legislation, gun control legislation from Governor Kasich?
Look, we support Governor Kasich's thoughts about trying to reduce gun injuries. I mean, he brought together leaders throughout the state to come up with gun safety policies that don't infringe on anyone's constitutional rights. These are things such as closing the gap around background checks, protecting police officers from piercing ammunition, keeping guns out of violent offenders' hands. And one of the things that we're really pushing is to have people store their guns safely at home.
Yeah, what about the mental health aspect?
So we, as the Ohio chapter of the AAP, we're looking at ways to work with families to store their gun safely at home if they have a child with mental illness. Another program that we've been starting is the Store It Safe program. The Store It Safe program is a way to teach healthcare providers how to have these discussions with families in a non-judgmental way of how to store their guns safely. Also, if funding is available, we provide them with a gun lock and a gun box safety. And so it's a way for them to store their gun safely, no different than any other barrier of prevention, such as putting a four-sided fence around a pool or locking your medications away from children.
Okay, if somebody wants to get more information, is there a place where they can go?
Yes, you can always go to our website, which is www.ohioaap.org.
Dr. Gittelman, thank you so much.
But of course, there is opposition, as you know, to the governor's proposal. And Chad Bouse is the secretary for the Buckeye Firearms Association, and he says politicians are rushing to blame and punish people who had nothing to do with the mass shootings. And on the group's website, he says, quote, "There should be no more talk of laws which only punish the law-abiding. There should be no more talk of mandating government control over private sales of guns between individuals. Instead," he says, "those who are truly seeking to make a difference should focus their efforts on improving our mental health system, securing our schools, eliminating so-called gun-free victim zones, ensuring the government entities input their data into the national database, and punishing violent offenders to the fullest extent of the law."